Hello, my name's Howard Dotson. I'm a healthcare chaplain, and today's podcast of Justice for All is access to healthcare is a human right. My journey in healthcare began in New York City 29 years ago when I worked as a psych tech. I've been a chaplain and pastor for the last 22 years. And when I was in graduate school at Sonoma State, I read a story about misguided belief in South Africa during the AIDS pandemic that if you were to have sex with a grandma or reverse your HIV status. That broke my heart. So I knew at some point in my journey I would be going to Africa to be part of the public health and chaplaincy response to the AIDS pandemic. Many of us feel like the AIDS pandemic is over because in the US it's a chronic illness. But in the developing world, where people don't have access to the ARV, the AIDS pandemic continues. So when I was in seminary, I was doing my residency at CSF Medical Center, and I took a summer to go to Durban, South Africa, to work with a nonprofit doing community health programs for KwaZulu-Natal province. KwaZulu-Natal, the infection rate was 33% of the population. There were AIDS orphans everywhere. One of the main people I worked with, he died of AIDS a month after I left, leaving his wife children. When I was in South Africa, I was blessed to go to the African Union, where Nelson Mandela spoke. And to me, he's a modern day Moses. When he spoke and I heard the roar of people in this refugee, it was one of the most profound moments of the journey. So when we did public health outreach in South Africa, I contracted tuberculosis. I'm not active, but I have TB in my blood now. So every time I get a mantle test, I have to go get Kabuto, the X-rays. A lot of people that immune suppressed end up having TB on top of their HIV. One of the best moments I had in South Africa was a poor man that family took everything from him, basically left him at a hospice. Beautiful time of year, and he wanted to be outside, soak in the sun, but he took his shoes. So the terrain wasn't level, going from his hospital unit to where he wanted to sit in the sun. There was rocks. So I looked at his feet, and I could tell that his feet were about the size of my feet. So I came back the next day with an extra pair of shoes, and they were perfect. That was one of the first, what I call synchronicities at Wings. So after that summer, I knew that HIV/AIDS ministry in Africa was going to be part of my ministry. So after I graduated seminary, I served for a year in Kenya with the Young Adult Volunteer Program. And I served two hospitals, Tumutuma Hospital, which is 2 hours north of Nairobi, and then Nairobi Hospital. And we did community health outreach there. And what I saw in Kenya was the miracle of the President's Emergency Plan for AIDS in Africa, PEPFAR. Maybe you know about Bono and the Red Campaign. Well, PEPFAR has saved millions of lives in Sub-Saharan Africa because people are finally getting access to air. Remember that before '96, when it was just AZT facing a terminal illness. But in '96, everything changed with the ARV. AIDS became more of a chronic illness. But in Africa, you don't have access to the ARV medication. They're living the AIDS pandemic as we did before the ARVs. So one of the amazing things that happened was this little church that I served as an intern, Petaluma Presbyterian Church. They gave a grant because the support groups that we were running, people living with HIV, there was a new program, but you had to be able to have transportation and pay for the blood test in order to get enrolled in the ARV program. So it's kind of a study to see if we take away the barriers, will people engage in access to healthcare habits of the chronic illness? 95% of the people, support groups, took me up on the offer to bring them to Provincial Hospital to get the blood test. Because they did that, they were on the waiting list. And they got the ARV. And many of those folks are living today because of the little church in Sonoma County that was going to give a grant. So as a young adult volunteer in Kenya, I served 10 volunteers, including myself. 5 of us Presbyterian, 5 I championed the young adult volunteer program because many of the people I served seminary, med school. This was a gap year between grad and college. So when I was in Kenya, one of my friends, Nathan, and I were reading Mount Beyond Mount, the memoir about Dr. Paul Farmer. Dr. Paul Farmer was an intern in Haiti. He was mentored by an Episcopal priest. And that was his baptism by fire to global health medicine. Relentless advocate for reducing healthcare disparities. Fortunately, he passed away recently. But NPR did his This I Believe. I want to share his story because he is an amazing advocate for the Partners in Health program has transformed public health throughout developing.
I believe in healthcare as a human right. I've worked as a doctor in many places and have seen where to be poor means to be bereft of rights. I saw early on, still just a medical student, the panicky dead end faced by so many of the destitute sick, a young woman dying in childbirth, a child writhing in the spasms of a terrible disease for which a vaccine has existed for more than a century, a friend whose guts were irreparably shredded by bacteria from impure water, an 8-year-old caught in crossfire. Limu bet, what a stupid death, goes one Haitian response. Finding such stupid deaths is never the work of one or even of a small group. I've had the privilege of joining many others providing medical care to people who would otherwise not be able to get it. The number of those eager to serve is impressive, and so is the amount that can be accomplished. I believe that stupid deaths can be averted. We've done it again and again. But this hard and painful work has never yet been an urgent global priority. The fight for health as a human right, a fight with real promise, has so far been plagued by failures. Failure because we're chronically short of resources. Failure because we're too often at the mercy of those with the power and money to decide the fates of hundreds of millions. Failure because ill health, as we've learned again and again, is more often than not a symptom of poverty and violence and inequality. And we do little to fight those when we provide just vaccines or only treatment for one disease or another. Every premature death, and there are millions of these each year, should be considered a rebuke. I know it's not enough to attend only to the immediate needs of the patient in front of me. We must also call attention to the failures and inadequacy of our own best efforts. The goal of preventing human suffering must be linked to the task of bringing others, many others, into a movement for basic rights. The most vulnerable, those whose rights are trampled, those rarely invited to summarize their convictions for a radio audience, still believe in human rights, in spite of, or perhaps because of, their own troubles. Seeing this in Haiti and elsewhere has moved me deeply and taught me a great deal. I move uneasily between the obligation to intervene and the troubling knowledge that much of the work we do, humanitarian or charitable, does not always lead us closer to our goal. That goal is nothing less than the refashioning of our world into one in which no one starves, drinks impure water, lives in fear of the powerful and violent, or dies ill and unattended. Of course, such a world is a utopia, and most of us know that we live in a dystopia. But all of us carry somewhere within us the belief that moving away from dystopia moves us towards something better and more humane. I still believe this.
So we are facing a crisis in Somalia where 6 million people are facing starvation because of drought. We have refugee crises throughout the world. People are drowning in our seas. They're dying of thirst in our deserts. And my next trip to Africa is going to be to Monrovia to advocate for the establishment of the Barway Collins School in memory of Barway Collins, 10-year-old who was killed by his father 8 years ago. And Louise teases me. She says, that's Barway's mom. She says she's going to send me out in the bush. She doesn't realize that when I was in Kenya, in rural Kenya, I was in the bush. Community outreach we did in South Africa was outside a game reserve, border with Zimbabwe. So I'm very comfortable in rural Africa. And the African Union is doing amazing work with the UN to bridge some of these gaps so that access to healthcare is a human right to their lives. So when you hear of a missionary or a nonprofit supporting our brothers and sisters in the two-thirds world, we don't have the luxuries and resources that we have. I urge you to support them and to remember Dr. Farmer's, this I believe. We need to move towards utopia, where human rights are respected and we live out Benjamin Franklin's quote, your best wealth is health. So prayers for every brother and sister seeking the great physician's touch.